Okay, so fungi nail infections, how to identify them and treat. So if your nail looks thick, yellow, crumbly, it could actually mean you have a fungi nail infection. So what are fungi nail infections? They are otherwise referred to as onychomycosis. They occur when fungi invade the nail. It could invade the nail bed, nail fold. So the nail has different parts. We have the nail bed, nail fold. We have the germinal matrix of the nail. We have the nail plate itself. So these are. Then we also have the hypo hyponicum and eponychium of the nail. So these are actually the parts of the nail. So the fungal infection can actually attack the nail bed or nail fold and destroy them. There you can have the onychomycosis, which are commonly caused by the dermatophytes, the yeast and mold. Then you can also have chronic paronychia, which is inflammation of the skin around the nail that is superimposed by a candida infection. So this can actually cause a fungal nail infection. So how do they actually present? They can present with pain on the nail bed and pain at the tip of the finger. Then they can also present with swelling. The nail could become swollen, edematous. Then they can also present with deformity. So the nail becomes deformed, is yellow, is thick, is brittle, is ugly looking. The nail itself is elevated from its bed, so there's deformity around that part. It can actually present that way. Then also the cuticle could be lost. Can actually You can have a lost cuticle. And again, the good thing about this, the thing about the fungal infection, in fact, there's nothing good about fungal infection, but the thing about fungal infection is that it's an infection that can manifest after about 6 weeks. It takes a longer time, and likewise its treatment takes a very long time to manifest. So after you've identified this pathology within the nail, how do you now investigate? You can do a fungi culture, do nail bed biopsy. You can also do potassium hydroxide microscopy to identify the hyphae or the yeast of fungi, that's the candida, right? Then after you've done this, you've made your definitive diagnosis is a fungal nail infection. Then you can now go ahead to treat. So the treatment involves general measures and also topical antifungal agents, systemic antifungal agents, and surgery. So the general measures are measures that is done in addition to the treatment. So it involves the fact that you need to avoid moist and frequently dipping your hands in water and chemicals. So I forgot to say that nail infection is commoner in people who frequently dip their hands in water. So you can find them in housekeepers, find them in healthcare workers, find them in dishwashers, and people who do jobs that their hands are commonly moist. These are the people you can actually find this kind of infection with. So for the topical, you can use creams like clotrimazole, miconazole cream, ketoconazole cream. So this cream have been found to be effective, even though it's believed that it may not actually invade the nail fully to treat this, and that's when the systemic antifungal medications are brought in, and this would include things like carbamazepine, itraconazole. So these systemic antifungal agents are used to treat these nail infections as well. They are taken for a longer time actually to treat these nail infections. Then in addition, you can do surgery. So surgery is done when there's collection. There's a collection, then you have to drain. Then when there is disfiguration or the nail is almost pulling out, then you might need to do a total or a partial nail avulsion. So these are the few ways you can actually manage a nail infection. So the prevention for nail infection would include one, avoid biting your nails. Two is avoid picking the cuticles. Keep a good hand hygiene. This will actually go a long way to prevent nail infections. Nail infections are better prevented than managed because they are really very stubborn infections. They are really very, very stubborn infections. Yeah. So in conclusion, you understand that nail is a very crucial part of the body, is exposed. It tells a lot about a person. when people see you with a very good nails, it looks very good. So a good knowledge of this is good, so that it can help us in our daily activity and everyday life to understand how to care for our nails. Thank you very much. I still remain Dr. Chigo. I'm here and I'll bring more medical videos to you. I hope you enjoyed this. Thank you very much.